The World Health Organization announced the possibility of a global shortage of syringes in 2022 for the COVID-19 vaccine in the 1 billion to 2 billion range. UN News reported a WHO senior advisor, Lisa Hedman, warned many may find themselves missing routine vaccinations unless manufacturing picks up. Hedman also said over 6.8 billion doses of COVID-19 vaccines are currently administered globally per year. That number nearly doubles the routine amount of inoculations annually delivered. Hedman says, quote, given the global manufacturing capacity of around 6 billion a year for immunization syringes, it's pretty clear that a deficit in 2022 of over 1 billion could happen if we continue with business as usual. To add another hurdle, syringes require 10 times more transportation space than a vaccine, which makes them more susceptible to delays. In October, UNICEF Executive Director Henrietta Fore released a statement and highlighted the same concern, assuming an unhindered vaccine supply next year. Fore said UNICEF secured nearly 3 billion auto-disabled syringes since 2020, but added a shortfall of over 2 billion auto-disabled syringes could occur as a result of attempting to meet new COVID-19 vaccination targets. Fore stated the shortage would affect syringes that lock automatically to prevent reuse. This would harm, quote, low and middle income countries where this type of syringe is critical for safety. To avoid the shortage, Fore provided a list of 6 actions. Expand access to both syringe sizes for most COVID-19 vaccines and for routine immunization. Have a secure and predictable supply of COVID-19 vaccines. Make injection equipment shipments by international freight carriers a priority. Stop hoarding safe injection equipment. Phase local COVID-19 vaccination rollouts, and consider expanded use of reuse prevention syringes in line with the national policy of the recipient countries. I'm Nolan Beilstein, and this is IN Now.